Audience, 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 audience. All right, whenever you want to go.
Hello everybody, my name is Jade, and today we're going to be talking about why you should volunteer in the NICU at Driscoll Children's Hospital, which is a non-profit organization. Babies are being sent to the NICU for a variety of problems. These are some, but are not limited to heart problems, difficulties breathing, prematurity, and drug use while in utero. Why you should volunteer in the NICU. Parents are not necessarily ready for the journey of the NICU. You can't actually prepare yourself for something like that. It's quite overwhelming. Incubators, monitors are very scary, like in any form, especially in the hospital. The sounds can really trigger parents into not wanting to come, which causes babies to be alone in the NICU. Basically, you are the difference in a parent's life. You can actually become an advocate for them. Parents, they can't handle it sometimes, and so they're gone. So then that's when you can actually come in and you can hold babies when parents cannot. You become the peace of mind for parents, especially workers. Nurses can sometimes become overwhelmed in the NICU as well, and so when they can't hold or feed a baby, that's when you can come in and help with that. Volunteering is very important into the hospital setting. It really helps with the flow of the hospital. A lot of people don't know that you can volunteer in almost any department of the hospital. Sometimes you have patient care and sometimes you don't. In the NICU, you would have patient care. Depending on the stability of the patient, you can feed and change and hold, but sometimes you're just there for the parents and advocacy. When you volunteer in the NICU, there are reasons that go below the surface that actually help you. When you cuddle with somebody, it releases a chemical in the brain called oxytocin, which can actually reduce stress in people, whether that be the baby or you. When you cuddle a baby, you actually help that baby with pain. NICU babies experience a lot of pain in the NICU from being like hooked up to machines, having central lines as IVs because they can't actually start an IV, they're too small. They're usually in a great deal of pain. So when you cuddle a baby, that oxytocin is released and it actually helps babies with that pain. Not to mention that when you cuddle a baby, they can feel that love, and most of the time it helps with their growth. So babies are more likely to breastfeed sooner if that's what mom is trying to do. Overall, it's really good, especially that oxytocin. When you volunteer in the NICU, you create connections with everybody that you're around, including the parents. You're going to become their hope and their light when there's none. Staff members, you can become close to them, especially if you're pursuing a degree that puts you in the hospital setting, then you can actually become a nurse, and then you are already made connections with the nurses that are there. You can actually become very close to the babies. You can watch them grow. NICU are for newborns, but it's not limited to that age. Some babies can stay in the NICU up to the first year of their life, and at that point, if they still need help, they would be transferred to an outside facility, or they would be transferred to PICU, which is our Pediatric Intensive Care Unit. So it just depends on what their needs are. But you can volunteer in the NICU and in the PICU, so you can actually stay with that baby for the entirety of their visit. And then as they get older, you're still involved. So it creates these connections that could potentially be lifelong if that's what you want. You can get quite the fulfillment working as a volunteer in the NICU. Over 50% of the babies in the NICU are drug-addicted babies. So when you go in and you hold these babies, you're actually giving them love that they've never actually experienced before. They can tell the difference. It's heartbreaking to see the babies when they need so much and no one's there to give it to them. So when you volunteer in the NICU, it's completely free, and you're going to feel like you're doing such a difference in these babies' lives, and everybody around you can see how much of a difference you're making. So in conclusion, volunteering is free. It doesn't cost anything. It takes a short application. I provided the link here for you guys if you are interested in doing it. It's very beneficial to you and to the babies. So if that's something you're interested in doing, the link is there and it's free. So every hospital with the NICU accepts volunteers, but you can volunteer in any part of the hospital, so it just depends on what you are interested in doing. And that's it. Thank you.